So now I have my system set up to be draining CSF continuously. One important thing to remember is that if your patient is on continuous CSF drainage, they should not be left unattended, and you should be checking the amount of CSF drained in this chamber every 1 to 2 hours. Now, another thing to note is that if your system is open to CSF drainage as well as to measure intracranial pressure, what's going to happen is the intracranial pressure is going to be affected by the pressure of the fluid draining into this chamber. So your ICP reading is actually not going to be correct. If you need to measure your intracranial pressure while your patient is on continuous CSF drainage, you need to temporarily stop the drainage and then measure your ICP. So what I would do, if I look at my stopcocks, this one is open to my transducer because this little wing means closed, and there should be a sterile cap here. This one is open to everything, so that means that the CSF is able to drain into my collection chamber. If I want to measure a real value for my intracranial pressure, I need to close this stopcock to my patient so that the CSF is not draining. So what I'm going to do is I'm going to do this. So right now, the CSF can still come here. It does not drain into the chamber, but my transducer can still sense it. Once I am done measuring my ICP, because I will be looking at the monitor and reading out the ICP value and recording it in the patient's chart, I can reopen the system again so that it's open 3 ways. Now, this is just one way to configure your system for ICP monitoring. Another way to do this is, again, I would be sterile when I'm setting up my system. I would not connect my transducer here, but instead I would just keep my sterile, not vented cap here. I will take extra pressure tubing that comes in a sterile package, and I can connect the pressure tubing directly to where my ventricular drain sits. So this is where my CSF measurement line originates. I can take off, because this is a 3-way stopcock, I can take off this cap. I can connect my pressure tubing here, and then connect it directly to the transducer. Of course, all of this would be primed with sterile saline with no preservatives. Okay, this would connect to the monitor, and now this sits in the patient's, well, a drain connected here sits in the patient's ventricle, and I'm measuring my intracranial pressure with this transducer, and it is a lot easier for me to level the transducer to the patient's tragus. Sometimes this transducer will be taped directly to the patient. Sometimes the transducer will be taped to the monitoring system like so, but this is just one of the ways to set this up. You are still able to drain CSF and measure the intracranial pressure.